Today I am gonna explain the aphorism number 1 in details. After this, I hope there won't be any doubt left. Aphorism number 1. The physician's high and only mission is to restore the sick to health, to cure, as it is termed. Just by reading, you almost got the meaning of this sentence, but there is also a deeper meaning. Let's see it. A physician's main and only mission is to restore a sick person to its normal health condition. It doesn't mean to treat only the visible or the pathology of a person, but to treat the patient as a whole, so that the person can restore his lost vitality force. According to Hahnemann, a person gets sick when his vital force gets deranged, and sick means the person is exposed to disease, and disease originates in the interior of a person before it affects physically. In other words, we can say that time is not favorable for the patient. Once he regains his lost vital force, his favorable time starts, he becomes stable, immunity gets strong, and the symptom along with the disease disappear. Thus, as a whole, the patient gets treated and restore his normal health condition. Just now, we studied what should be the mission of a physician. Now let's come to the footnote. In the footnote, we will see that what should not be the mission of a physician. His mission is not, however, to construct so-called systems by interweaving empty speculations and hypotheses concerning the internal essential nature of the vital processes and the mode in which diseases originates in the interior of the organisms, whereon so many physicians have hitherto ambitiously wasted their talents and their time. Now let's understand the simple meaning of this line. A physician should not create or construct any treatment system based on empty speculation and hypotheses or assumptions regarding disease phenomena. Okay. Till now means at the time of Hahnemann, many physicians wasted their talents and time by doing so. Now let's see the next line of the footnote. Nor it is to attempt to give countless explanations regarding the phenomena in diseases and their proximate cause, which must ever remain concealed, wrapped in unintelligible words and an inflated abstract mode of expression, which should sound very loud in order to astonish the ignorant, whilst sick humanity sighs in vain for aid. Now let's understand the simple meaning of this line. Neither the mission of a physician is to show off how intelligent he is by giving countless complex explanations regarding disease phenomena. It may sound intelligent only among the ignorant people, but in real it is useless to a sick person because all those explanations are based on empty speculation and assumption, and the sick persons do not get better. Now let's come to the last line of this footnote. Of such learned reveries, to which the name of theoretic medicine is given, and for which special professorships are instituted, we have had quite enough, and it is now high time that all who call themselves physicians should at length cease to deceive suffering mankind with mere talk, and begin now, instead for once, to act, that is really to help and to cure. Here, learned reveries means theoretic medicine doctors. Who are called theoretic medicine doctors? I'll come to that a minute later. A bit, just wait. Now just understand that we have had quite enough the theoretic medicine doctors. All the people who call themselves as physicians should not explain and treat the disease based on empty speculation and hypotheses, as those lead to deceiving the suffering mankind. Instead, he should learn to treat the patient properly as a whole from inside and outside, which will help the patient in a proper way. Now let's understand the main point of the whole footnote. In the footnote, Hahnemann actually mentioned about the theoretic medicine system. What is theoretic medicine system? Theoretic medicine system is the current practice of medicine system during Hahnemann time. He used to call it as old school medicine practice, and this theoretic medicine practice is based on empty speculation and hypothesis. It is not based on any proper law or principle. So Hahnemann used to call it as old school practice, and it has a materialistic approach. Materialistic approach means the disease is just the visible pathology or the organ pathology. So the Hahnemann says, begin now to treat the patient as a whole and not just treat the visible pathology or the organ pathology. And thus, here we change our terminology that treat the patient, not the disease. As disease is not just the organ pathology, but it was present there before the organ pathology. It means the patient gets affected mentally at first, then he becomes unstable, immunity gets weak, then he gets exposed to organ pathology physically. So begin now to understand the real nature of a disease and to treat it accordingly. So this is the whole explanation of the aphorism number 1. In the following, I have put some very easy words in between the footnote so that it gets very easy for you to understand just by reading it. Try it once from now. Just by reading, you will get the meaning of it. If you still have any doubt, please ask me in the comment sections. Thank you.